want to begin by thanking the Honourable Member for Strangford for his comprehensive exposition of this issue, setting out the scale of the challenges and in tackling obesity and how the governments across the United Kingdom must do all they can to tackle obesity across the UK in a holistic way. And I'm glad to be able to participate in this debate on obesity and COVID-19 because I actually think it is very important, as many have said. There is huge consensus across this chamber today. We have a real public health challenge and we need to tackle it with all the influence and tools that we have. The pervasiveness of obesity in our society, coupled with the health and economic consequences and the current additional risk associated between obesity and COVID-19, shows that supporting adults and children to be a healthy weight must be and must continue to be a public health priority. We know that the recent report from Public Health England provided evidence-based insights into the relationship between excess weight and COVID-19. We've heard today, the higher your BMI, the more likely you are to test positive for COVID-19, you're more likely to be admitted into intensive care, and potentially you're more likely to die of a COVID-related death. And we heard from the Honourable Member from the Vale of Clwyd that if you're obese, you are 37% higher than average, more likely to die of COVID-19. And these facts persist when studies are adjusted for confounding factors such as age, gender, socio-economic status, ethnicity and comorbidities. Now, over the years since 2015, when I was first elected, I've spoken on a number of debates on issues such as healthy eating, junk foods, healthy lifestyles and so on. And one thing I always think it's important, and it has been noted here today already, is that we must always try hard not to sound as though we are telling people off for the food that they eat, stigmatising the food they give to their children, because if we do sound like that, as though that's what we're doing, then we will not get our message across, as the Honourable Member for Bath said. And the message that we want to get across is that we understand that obesity is one of the most complex, one of the biggest public health challenges of our time. As the Member for South West Bedfordshire reminded us, the UK is the most obese in Europe, with the exception of Malta. But I believe this is a matter that has to be treated with a bit of sensitivity. And we know it's easy to eat healthily, the better off you are financially. And by way of illustration, Mr Chair, it costs £3 in Tesco's for 250 grams of blueberries. Blueberries, of course, are very healthy. They are a superfood. But in Iceland supermarket, you can buy 10 chicken burgers for £2, which are not so healthy. If you're on a budget as a parent, your priority is to feed your children and keep them safe from hunger, if at all possible. No one has the right to tell these parents that their choices are bad. The fact is that you're doing the best that you can with the income that you have. Now, by another example, in Tesco you can buy 4 oranges for £1.50, but you can also buy a multi-pack of 10 packets of crisps for 99p. So healthy choices, although we know the blueberries and the orange are the healthy choice, we know that the burgers and the crisps are not. But if you're on a very limited income, healthy choices are not always on your menu, as others have pointed out. I think it's clear that the key to tackling obesity is to tackle poverty and inequality. We also know that the poorer you are, the poorer your health outcomes and your lifestyle outcomes. I know that because I grew up in poverty and my parents both died in their early 50s, the same age that I am now. And their poverty and early deaths are not coincidental, not at all. And it's the same story up and down our constituencies wherever poverty thrives and preys on our constituents. Obesity doesn't just make people more prone to COVID and the serious consequences of COVID, although it certainly does that. Obesity prevents people living fulfilled and active lives. It's the second biggest preventable cause of cancer and is linked to around 2,200 cases of cancer every year in Scotland. Living with extra weight or obesity is the most significant risk factor for developing type 2 diabetes and can result in increased risk of other conditions, including cardiovascular disease and hypertension. Now, in Scotland, the annual cost of treating conditions associated with being overweight and obese is estimated to range from 363 million to 600 million. The total annual cost to the economy in Scotland of overweight and obesity, including labour market-related costs such as lost productivity, is between 1 and 4.6 billion. And the Honourable Member for Stoke-on-Trent Central set out the costs for across the UK. Last year's study showed that in Scotland, 66% of adults over the age of 16 were overweight, including 29% who were obese. Men are more likely to be affected, but obesity rates are consistently higher in our most deprived communities compared to the least deprived. And as the Honourable Member for the Vale of Clwyd reminded us, tackling obesity must ultimately be about tackling social injustice, a sentiment that I think everybody in the chamber can accept. What COVID has exposed with crystal clarity, if it were needed, and what it has exacerbated, are the shocking health inequalities in our nation. I want to see a Scotland, I want to see a United Kingdom, where people eat well and have a healthy weight and are physically active. Who wouldn't want that? The Scottish Government has committed to supporting a targeted approach to improving healthier eating for those on low incomes, expand and improve access to weight management services for those with or at risk of type 2 diabetes, and extend access to weight management services to everyone living with obesity. And we seek to build on and consolidate the positive physical activity behaviour changes we have seen during COVID-19, such as walking and cycling, and a whole range of measures I don't have time to go into. And I'm keen for the Minister today to set out similar actions across the UK and how Scotland and the rest of the UK can learn from each other and share good practice in what more can be done to tackle obesity. However, fundamentally and ultimately, the scourge of poverty is at the heart of tackling all inequalities. As in other ways, the COVID crisis has thrown inequalities in our society into stark relief, and this debate has been very worthwhile in underlining that. When this COVID crisis is behind us, as one day it will be, the sooner the better, I hope that across the UK, all of us, citizens and governments alike, do not forget the lessons that COVID has taught us about our society and the terrible and ongoing impact of poverty in our communities.